Erectile dysfunction, the goal of its treatment is a patient satisfaction.
Good to have you here. Good to see you again.
Good to see you.
Thank you for coming.
Thank you for inviting me. So Eric, I just want to tell the audiences, a little different from the previous APSS meeting. You are chair of this meeting this year, and you added a lot of, you helped to include a lot of penile implant sessions with this meeting. May I ask you the reason why?
I think probably twofold. First of all, I think penile implant awareness is at its infancy in Asia. Certainly there's a lot of issue regarding the adoption of penile implant. And the second is probably from a personal bias point of view, is an opportunity to invite all my friends who are big volume implanters like yourself to come to APSSM, and also to try to promote a stage where we can exchange idea and to try to improve about the current understanding and also the surgical performance.
Yeah, correct. It is not that well, unlike what we thought, unlike what I thought actually, this really stage of infancy of the awareness. I guess, this year's meeting is especially important because, like this is a valuable chance for the surgeons among the different, settings. I'll say. Other thing I want to, ask you was that it's a more fundamental question. As a point of audience is, why do they think that penile implant is so important? They can have questions like that, right? So why do we really want to, talk more about penile implant, make more awareness around the society about penile implant? We are not a company, guys. We are surgeons, but still we talk more about surgical treatment option for the erectile dysfunction. May I ask you the reason why? Is it for you?
I think there's a couple of reasons behind it. Number one is that we have international organization issue what we call the standard of care for erectile dysfunction. And unfortunately, the first line treatment is always about trying to optimize the medical condition before proceeding to oral medical therapy and then proceed to something more invasive like injection and implant. So by the time you come to the implant is always further down the stage. Correct. And also it is a surgery. So a lot of patients are not aware about what exactly is involved in the surgery. And more importantly also is the fear of having something that is foreign implanted inside their body. So this is a lot of factors that certainly can play a role in why the adoption of implant as a standard of care in many patients are difficult from that point of view. And also another point that we sort of brought up a bit earlier in the discussion is about the surgeon awareness and also comfort level. Many surgeons would have the opportunity to go and learn about penile implant surgery, but have the difficulty to try to convey the message to their patient. And the lack of time between the actual fellowship or preceptorship and actually doing the surgery on the patient, they have diminished confidence level. So if they're not confident enough to promote or advocate the surgery, and also the lack of experience to do the surgery, it makes it more difficult for them to actually counsel the patient to accept implant as a form of treatment.
Well, I have different kind of. You're more like an educator, but me myself, for the past it's almost 6 years. I was always thinking about why penile implants. Why do I want to talk about this? Well, of course, if I do more surgeries, I can make more money for sure. But is that all I need? Is that why I do this? I was concerned. So for the past 5 years, I think I got a little hint of why I do this now. Because at first I was not really able to understand why this was important. Why Dr. Wilson was trying so hard to train me with this one. But after I experienced it, it's almost about 1,000 patients I have seen. I cannot forget their faces after 6 months. So many of them has dramatic changes, very dramatic changes in their life. So that really gave me a thought that, it's little unfair if the man doesn't know about they cannot get the treatment because they didn't know it. So that's why I want to talk more about this treatment. But talk about this surgery alone was not enough.
No, it's not enough.
So I need more comrades in this battle. So there's a why I agreed with your kind of education more educating more physicians in the field so that we can help more people.
I agree with you. I think it's important that there should be awareness, there should be excitement, and there should be anticipation that this is going to be a standard of treatment for many men that is waiting out there that require this form of surgery.
Hopefully, the government and the companies and all the players in the part, they can, and the patients as well.
Yes.
They could get, I do think that they can get more benefit. Yeah, we are, as far as I know, I guess it's becoming more, rather than competitors, we should be companions in
I
this
think
field.
so, yeah.
If we compete each other, well, they can, win a battle, but they can never win a war. It's a lifelong, journey for us. So I wish this kind of training sessions can help them out.
I think so. We should look upon it not as being a strategic competitor, but more as a strategic allies. That's the way to go. Because that basically means that our patients are a lot more happier. And as you say, happy patient, happy surgeon.
I guess. Well, if you are trying to define whether he's a good prosthetic surgeon or not, you can see whether he's happy or not.
That is correct.
If he's unhappy,
Yes.
I do think so. All right, so for the next 4 days, we'll have a long conferences, right?
Will be a lot of conference, and I think that we'll be working you very hard for the conference.
So from today to the until the Saturday, yes. Well, we'll keep filming about talking about and showing the audiences what we do. So I guess that will be a good view for them how doctors are trying to how do we study.
Yes.
Thank you.
My pleasure. Thank you again.